Lipid panel. I like this in psychiatry because I'm sure everybody will be concerned about looking at their cholesterol being elevated. In psychiatry, I'm more interested in the relationship between cholesterol and mood and vascular health. In this journal and from Current Psychiatry, they talk about untangling the relationship. What happened is patients with mood disorders have lower cholesterol levels. I saw this in a patient who was taking statins and their cholesterol was 100 and they're complaining of depression. I said, you got to stop that statin. Obviously, it did the job, but it did the job too well. So I said, tell your doctor, your psychiatrist said, stop that. We'll monitor it. But even looking at a cholesterol 250 does not scare me. In fact, I like it there because what happens is it is better for the brain because that's what they use to cover the brain cells. It's a lipid layer. So let's talk about how low cholesterol causes mood disorders. This article talks about how low serotonin function can lead to depression, suicide, impulsivity, and aggression. But the other reason I believe that it happens is because if you give the patient ability to decrease their cholesterol too much, you have basically starved the brain from the cholesterol it needed to make the brain cells healthy. So that's, I think, the other reason why you have depression when you have low cholesterol. And one of the things this study also showed is that out of all the cholesterol, the triglycerides is the one that's elevated. So you can see psychiatric symptoms, syndromes, behaviors associated with low cholesterol. Anxiety, depression, emotional lability, euphoria, impulsivity, irritability, suicide, and aggression. The syndromes you can see diagnosis is anorexia, bipolar, borderline personality, major depressive disorder, and seasonal affective disorder. And the behaviors are pretty bad. They can try to kill themselves, especially with people who are malnourished, and they have potential for violence because the fact that their judgment is impaired because their brain cells are not healthy from not having enough protection around the brain cells from the cholesterol that makes the lipid layer. How do you treat low cholesterol? Obviously, we want to avoid statins. Okay, once you get down to a pretty good level, like under 200, no more statins for you. And then you do treat them with omega-3 fatty acids, high dose, anywhere between 2,000 to 3,000, sometimes 4,000. Why? Because the body is deprived of this cholesterol, so it needs a source of it outside in order to get the brain cells healthy. Dr. Greenblatt, who taught me about this, he talks about his patient who's 20 years old coming in and out of psych unit trying to kill themselves all the time. Then I don't know what possessed him to check his cholesterol. It was about 100. From there, they treated the low cholesterol, no more suicide, no more depression. So you should try to treat triglycerides because this condition is the one that's really problematic for a lot of people. You know, weight loss, exercise, smoking cessation if you are, alcohol. Alcoholics can have very high triglycerides. So simple treatment, stop your drinking. If the triglycerides are 500, you can give certain things, okay, like low fibrate, along with omega-3 fatty acids and a very low fat diet at that point. B12 deficiency, the main thing is macrocytic anemia. You can see that in liver disease, alcoholics, malabsorption, pernicious anemia, and hypothyroidism. With all that, you can still have psychiatric symptoms if you just think about that cycle, the methylation cycle, as well as physical symptoms. So let's talk about why B12 deficiency can cause depression. This is what we call the pathophysiology of depression. B12 deficiency still causes a buildup of homocysteine. Homocysteine is bad. It impairs the mitochondria, so the mitochondria is no longer giving out energy, as well as it causes oxidative stress. What happens? Cell death in the brain, nerve cell death. So no more neurotransmitter functioning. Things are not coming out, and that's how you get depressed. This was a review article from Curious, October 2020, titled B12 Supplementation, Preventing Onset and Improving Prognosis of Depression. So these are the psychiatric conditions that you can see B12 deficiency. They're really tired, they don't have energy, they can be irritable, they're depressed, changes in the way they think and behave, memory issues, judgment. As we know, there is such a thing as dementia related to B12, as well as eating disorder and weight loss issues. All the physical symptoms, you feel faint headaches, palpitations, tinnitus is a big thing. And we're taught look for oral ulcers, pins and needle feeling. So when patients complain of that, you better check their B12. It's not just about eliciting their psychiatric symptoms, abnormalities in their gait, as well as vision disturbances. B12, how do you treat it? Before we talk about that, treating it, according to that article, can delay the onset of depression, improve the effects of the antidepressant. And how does it happen? Because as you know, B12 is involved in that methylation cycle that makes all those good neurotransmitters, as well as B6 and folate. All those B vitamins are very important also in creating all those good feel neurotransmitters. So they can also have an impact on your depression. When it comes to mental health, some people will think, oh, your B12 is normal and it's around 300. But if you're feeling like crap, you're feeling tired, you're feeling depressed, I usually will not hesitate. If it's below 400, I go ahead and just give it to them. And it's usually 1,000 micrograms a day. However, you have to think about, eliciting the history of they had gastric bypass, then you may have to give them injections or sublingual. Also, you have to consider, this is why I talk about the genetics guides our treatment when it comes to even supplements. Low COMT, if you treat the B12 deficiency in low COMT, that will increase all those neurotransmitters. So at times you may have to give just half or not at all, especially if they're not tolerating the B12 replacement because it's making them more anxious.